In this video, we talk about why your penis may appear to be shrinking as you get older. Penile shrinkage, even though it's rarely discussed, is real. But what's even more important to understand is why it happens and what can be done about it. Because once you know what's going on inside your body, you're no longer left guessing or falling for gimmicks and misleading advice. Men often carry this quiet concern for years. They may feel embarrassed. They might compare themselves to their younger self. Some avoid intimacy. Others assume it's punishment for aging. And yet very few ever bring it up with a doctor. That silence leads to confusion because online, the information is often inconsistent. You might see messages like, take this pill to grow it back, do this stretch every day. It's all in your head. In reality, there are multiple, overlapping reasons why the penis can lose visible length or fullness as men age, and not all of them are obvious. For example, did you know that the loss of spontaneous erections, especially nighttime ones, can actually affect the physical tissue inside the penis? Or that certain health conditions like high blood pressure or diabetes can quietly reduce blood flow over time, not just to your heart, but to your most sensitive areas? Most men don't connect those dots, and almost no one explains it to them clearly, without shame, and with respect for their dignity. So today, that's what we're going to do. We'll walk through what the science actually says, no hype, no fear. We'll look at how the body changes with age, what's normal, what's preventable, and what's treatable. This is especially important for men in their 60s and 70s, because this stage of life comes with a lot of natural changes, but that doesn't mean you're helpless or that you just have to live with it. But before we get into solutions, we need to be clear on the problem, because understanding why this happens is the key to slowing it down, or even improving it. Let's start by clearing up the biggest misconception. Most men believe that if their penis appears smaller in their 60s or 70s, it must be caused by aging alone, as if it's just part of getting older and there's nothing else to understand. But the truth is more nuanced than that. Yes, aging plays a role, but it's not just about the number of candles on your birthday cake. It's about what happens inside your body over time. And many of those changes are related to health, habits, and circulation, not just the passage of time. Men can experience a gradual reduction in penile length or fullness for several reasons, and the most common one is reduced blood flow. As we age, our blood vessels naturally become less flexible. Some of that is due to atherosclerosis, the slow buildup of plaque inside the arteries. And while most people associate that with heart disease, it also affects the arteries that supply the pelvic region and the penis. When less blood flows in, especially during times of arousal or spontaneous nighttime erections, the tissues inside the penis don't stretch as often or as fully. Over time, this can lead to something called tissue atrophy, where parts of the erectile tissue lose some of their elasticity and tone. It's a little like a muscle that hasn't been used in a while. It becomes smaller, less responsive, and less firm. This is why one common contributor to shrinkage is actually fewer erections, especially at night. Most healthy men have several spontaneous erections during deep sleep. These are not about desire. They're part of the body's natural maintenance system, keeping the penile tissues oxygenated and flexible. But with age, lower testosterone, and certain health conditions, those nighttime erections become less frequent, and the tissues lose some of their stretch and function. That's not your fault, but it is your body talking to you. Another factor most men haven't heard of is Peyronie's disease. This condition causes scar-like plaques to form inside the shaft, often after minor, unnoticed injuries or bending during intimacy. Over time, these plaques can cause curvature, discomfort, or shortening because the scar tissue doesn't stretch like healthy tissue. It's more common than you might think, especially in men over 50, and it's one of the reasons visible size may decrease even if your overall health is decent. Now, let's talk about surgery, particularly procedures related to the prostate. Men who've undergone a prostatectomy, often to treat prostate cancer, may notice a subtle decrease in penile length afterward. This isn't due to tissue being removed, but rather to how the procedure affects surrounding nerves and structures. The average length change can range from 0.3 to 1 centimeter, but in some cases, recovery is possible over the course of months or even years. Still, that change can feel disheartening, especially if no one explained it beforehand. Then there's body fat. This one is often misunderstood. As men age, they often gain weight around the lower abdomen and pubic area. This creates a fat pad, sometimes called a suprapubic fat pad, which can make the penis appear shorter, even if the internal structure hasn't changed. In reality, the shaft is simply being obscured by surrounding tissue. That doesn't make it any less frustrating, but it's important to know the difference between real shrinkage and what's hidden from view. And of course, We can't ignore lifestyle-related vascular problems, things like smoking, uncontrolled diabetes, high blood pressure, or chronic inflammation. Each of these conditions reduces nitric oxide production, narrows the blood vessels, and interferes with the smooth muscle relaxation required for full blood flow. Over time, that doesn't just affect performance, it affects structure. Now here's where it gets interesting. Some men experience what's called retractile penis, where the penis temporarily draws inward, especially in colder weather or during stress. That's different from true anatomical shrinkage, but it's often misinterpreted. It's reversible and typically harmless, but it can add to the confusion. And in rare cases, there's a psychological condition called choro, where a man believes his penis is shrinking or retracting even though there's no physical change. This is extremely rare and usually linked to anxiety or cultural beliefs, but it reminds us just how powerful perception can be. Now here's where it gets personal and surprisingly hopeful, because once you understand what's really going on inside the body, it becomes easier to see how your daily choices and your overall health connect directly to the changes you may be noticing in size, shape, or function. Let's start with structure. The penis isn't just a skin-covered tube. It's a highly specialized organ made up of smooth muscle, elastic connective tissue, nerve fibers, and vascular chambers, known as the corpora cavernosa. When you're aroused, these chambers fill with blood, but they also expand and stretch thanks to flexible tissue and healthy blood vessels. This internal stretch, which happens during both intimacy and spontaneous erection, is what helps maintain tissue length, shape, and sensitivity over time. But if the tissue isn't regularly stretched, either due to reduced erections, poor blood flow, or other factors we mentioned earlier, something changes. The smooth muscle fibers begin to atrophy, meaning they shrink or weaken, and connective tissue can gradually stiffen and develop areas of fibrosis, a form of microscopic scarring that reduces elasticity. Think of it like a balloon. If you inflate it regularly, it stays soft and flexible, but if you let it sit unused for a long time, it becomes harder to inflate and may not return to its original shape. Your penile tissue works in a similar way. This explains why reduced frequency of erections, especially during sleep, isn't just a symptom. It can actually become a cause of shrinkage, as the tissues lose oxygenation and elasticity from inactivity. Now, let's talk about testosterone, a hormone often misunderstood. Many men associate testosterone purely with drive or performance, but one of its lesser-known roles is supporting healthy blood vessel function, collagen production, and the maintenance of smooth muscle tone throughout the body, including in the penis. When testosterone levels decline, which they naturally do with age, blood flow tends to decrease, sensitivity may change, and tissues may not recover or regenerate as efficiently. This doesn't mean every man needs testosterone therapy, but it does help explain why lower levels can quietly contribute to structural changes over time. Another overlooked piece of the puzzle is the nervous system. Penile length and function aren't just about blood and hormones, they also depend on healthy nerve signaling. After surgeries like a prostatectomy, or with conditions like diabetes, the nerves that control arousal, engorgement, and relaxation can be disrupted. This reduces the signal that tells the body it's time to fill and stretch. Without that signal, even if the blood flow is there, the tissue doesn't respond the same way, and shrinkage may follow. Importantly, this doesn't mean the penis is damaged beyond help. It means the pathways, blood, tissue, nerve need support, and sometimes retraining. Now, one more subtle but essential factor: inflammation. Chronic, low-level inflammation, often tied to poor diet, smoking, obesity, or sedentary living, damages the lining of blood vessels. This includes the small arteries that supply the pelvic region. Over time, this restricts nitric oxide production, a key molecule that allows the penis to relax and fill. Less nitric oxide means less stretch. Less stretch means less tissue preservation. So when a man in his 60s or 70s notices that his penis seems smaller, whether in length, girth, or fullness, it's rarely due to just one cause. It's usually the result of these many factors layering over time. A little less blood flow each year, a few more missed nighttime erections, subtle drops in testosterone, slight weight gain around the lower belly, a gradual decline in elasticity, and possibly a history of surgery or scar tissue. None of this makes you broken. It makes you human, and part of a process that many men are experiencing, even if no one's talking about it. The key takeaway here is this: shrinkage isn't just about what you see on the outside. It's about what's happening at the microscopic level in your blood vessels, your nerves, your hormones, and your tissues. But once you understand that, you're no longer stuck feeling confused or helpless. Here are 5 safe ways to support penile health and help slow, minimize, or even slightly reverse the shrinkage that can occur with age. 1. Support blood flow daily, not occasionally. Your penile tissue depends on healthy circulation. That means what supports your heart also supports your performance and structure, especially over time. Start by moving your body. A daily 20 to 30-minute walk improves circulation, reduces arterial stiffness, and boosts nitric oxide production, the molecule that helps your blood vessels relax and fill. Even light physical activity has been shown to increase both daytime and nighttime erections in older men. Also consider blood flow-friendly foods. Leafy greens like spinach and arugula, beets, berries, olive oil, cold water fish. These support endothelial health, the inner lining of your blood vessels, which is crucial for full engorgement and tissue preservation. And if you smoke, know this. Tobacco damages small vessels quickly, and penile arteries are often the first to show the effects. Stopping can significantly improve both visible length and function within months. This isn't about performance. It's about preserving structure through daily, steady blood supply. 2. Maintain healthy testosterone, naturally and safely. Testosterone helps maintain penile tissue through several indirect pathways. It supports muscle tone, preserves collagen and connective tissue, and enhances nitric oxide signaling, especially during nighttime erections. Low testosterone won't always lead to shrinkage, but it can contribute over time, especially if it drops below your body's functional threshold. Safe, natural ways to support your testosterone include consistent, restorative sleep 7 to 8 hours, strength training or resistance bands 2 to 3 times per week, reducing excessive alcohol, managing blood sugar and insulin resistance, avoiding chronic calorie restriction or extreme dieting. And if levels remain low despite healthy habits, your provider may discuss whether testosterone therapy is appropriate based on symptoms, labs, and overall health. Remember, it's not about chasing numbers. It's about keeping your hormonal environment supportive of tissue maintenance as you age. 3. Reduce the fat pad. Reveal what's already there. One of the most frustrating types of shrinkage isn't anatomical, it's visual. As body fat accumulates in the lower abdomen and pubic area, it forms what's known as the suprapubic fat pad. This fat essentially buries part of the penile shaft, making the penis appear shorter even when no structural change has occurred. According to urologic research, for every 35 pounds gained, the visible penis can appear about 1 inch shorter. But the inverse is also true. Modest weight loss can make a noticeable difference in what you see and feel. You don't need extreme diets. Just reducing processed foods, walking daily, and cutting back on sugar and refined carbohydrates can gradually shrink that fat pad and, in turn, reveal more of your original length. It's not magic, it's anatomy. 4. Address underlying conditions, especially diabetes, hypertension, and prostate recovery. Certain health issues directly impact penile structure. Diabetes can damage blood vessels and nerves that support both engorgement and spontaneous nighttime erections. Hypertension stiffens arteries and reduces the body's ability to relax blood vessels fully. Prostate surgery, while often life-saving, can affect nerve signaling and reduce structural support to surrounding tissues. Managing these conditions doesn't just help your heart or kidneys, it also protects the health of your penile tissue. Work with your primary care provider or urologist to monitor blood sugar. Keep blood pressure in a safe range. Follow a safe recovery plan after prostate treatment. And if you've had surgery and noticed shrinkage, ask whether postoperative support, like penile rehabilitation therapy, is appropriate for you. Sometimes what feels permanent is actually part of a healing process. 5. Consider pelvic support tools with your doctor's guidance. For some men, gentle physical tools can help maintain tissue health and stretch capacity, especially after periods of inactivity or reduced erections. Examples include vacuum erection devices, VEDs, which draw blood into the penis to help oxygenate and gently stretch the tissue. Penile traction therapy, often used in cases of Peyronie's disease or post-surgical shortening under medical supervision. Pelvic floor exercises, sometimes called Kegels for men, which support muscle tone and improve circulation. These are not about enhancement, they're about preservation, keeping the tissues active and supported. But please note, not every product sold online is safe or effective. If you're exploring trusted options, look for those backed by clinical studies or recommended by urologists. And always ask your provider if it's a good fit for your situation, especially if you have scar tissue, curvature, or a history of surgery. The most important thing to remember is this: you are not stuck with whatever changes you've seen. Your body is constantly adapting, and the same way shrinkage can happen gradually, so can improvement. It's not about fixing everything overnight. It's about smart, consistent action that supports circulation, tissue flexibility, and overall health. Start small. small, be steady, and give your body what it needs to maintain what nature gave you. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.